Get to the cath lab at 6 a.m. I prep for and consent the first case in the cath lab all day. Last case ends after 5 p.m. and it's a heart transplant with a biopsy. So they need an echo and to be admitted. I do the echo myself, the echo report myself, and now it's after 5 p.m. so I admit them to the hospital too myself. And I do their cath report and the 3 other cath reports from the day myself. And now I'm on call and I get sign out for all of our services because I cover as the primary cardiology point of contact for the cardiac ICU, pediatric ICU, neonatal ICU, the entire children's hospital, labor and delivery, the emergency department, every other hospital and ER in the state and chunk of the region, and our own hospitalized cardiology patients on our service and the post-operative CT surgery patients on the hospital floor. I get a call from the ED that there's a Fontan failure that I consult on and diagnose myself and admit to myself and do the echo on myself, as well as the consult note and the echo report. During this time, I remain on call for all consults and known patients, for all parent calls, for all the cardiology patients outside of the hospital for the entire cardiology group, and CT surgery patients, including prescription renewals and parent questions. I get called from an outside hospital about a blue baby with an outside echo that I diagnose myself and have flown by plane to myself to be hospitalized, where they're admitted and I give management and do an echo on, which I interpret myself, and now it's 2 a.m. I keep working until 6 a.m. when I go back to the cath lab to prep and consent for the first cath of the day. I remain in the cath lab all day long, responsible for all cases, knowing and participating in their care that entire day, and the cath reports that get generated that day, getting quizzed throughout each case. That was one call shift in fellowship, and my first year was like that every 3rd or 4th day for a year. And when the Heart Center leadership held an all-staff meeting and presented a chart to thank everyone for their work, the fellows weren't even listed.